Do you ever wince whenever you bite into a cold ice cream or drink a hot cup of coffee? Well, you're not alone. Over 40 million adults in the United States suffer from sensitive teeth. Now, the good news is there might be a simple way to get rid of your sensitivity. So in this video, I'm going to go over the best ways to improve sensitive teeth so that you can start enjoying your food like normal again. Now, what causes teeth to be sensitive in the first place? The main reason is because of thinning enamel, or where your outer layer of your tooth, again your enamel, will start to wear away and expose the dentin underneath. The dentin is essentially a path to the nerve inside the tooth. So this is something called the hydrodynamic theory, where your dentin is made up of these tiny tubules, and these tubules have fluid inside of them that channel to the nerve. So things that are cold or hot or even sweet or acidic will stimulate the fluid in these tubules. So whenever you have one of these stimuli, they will cause the fluid in these tubules to move, and that will trigger the nerve. I know, it's kind of confusing, right? But basically, the more dentin or even the more root structure that you have exposed on your tooth, then the more sensitive your teeth will be. Now, this doesn't happen to everybody, because there's plenty of people where they have chipping or they have gum recession, where their root structure or their dentin is exposed, but they have absolutely no sensitivity to it. So what the heck's up with that? Well, there's a couple of reasons. The first is, as you get older, your nerve kind of recedes in your teeth. So normally young, healthy teeth have this big pulp tissue in the middle of the tooth. And you can see this on x-rays. You can see the middle of the tooth has this dark spot on the x-ray, which is this big pulp chamber, and that's where the nerve lies. But as you get older, this pulp kind of recedes and gets smaller and smaller and kind of pulls away from the outside of the tooth. This is essentially a protective mechanism, because over the years, your teeth take on more and more wear and more damage, and over time, your pulp gets slightly more and more damaged, and it thinks, hey, I need to protect myself, and it starts pulling away more and more. So if someone's pulp tissue starts to recede more and more, then they're not going to feel as much because their nerve isn't as exposed. Sometimes you can even do fillings on people that are older without even doing any numbing, because their nerve tissue is so receded that you don't even have to get them numb to do a small filling. The second reason that some people might not feel sensitive is because of something called tertiary dentin. Tertiary dentin is still your normal dentin, which is the inner layer of your tooth, but it's formed in response to some sort of trauma or some sort of cavity that's getting in, or even just your dentin being exposed. It's basically a way for your tooth to naturally defend itself. So you have these things called odontoblasts, which are these cells in the pulp that produce your dentin. Now, in response to some sort of trauma or a cavity forming and starting to damage the nerve, these odontoblasts will produce this tertiary dentin to seal off the normal dentin. In doing so, it will seal off those exposed dentinal tubules. So you won't get as much of that response to your nerve because all those channels are blocked off. Now, some people aren't so lucky and they still have sensitivity even with their own body's natural defense system going on. So some of the common causes of teeth sensitivity are anything that will cause trauma to your teeth and gums. So things like aggressive brushing, where you're brushing super hard or using a really hard bristle toothbrush. You should really be brushing with a soft bristle toothbrush and brushing really gently so you don't damage your teeth and your gums. But if you're a very aggressive brusher, then you're going to slowly wear away the enamel or remove that outer layer of your tooth, which doesn't come back, or you can even damage your gums and cause your gums to recede and start exposing the root structure of your teeth. Either way, you're going to start exposing more of those nerve channels in your teeth. Another common cause is acidic foods. So pretty much any drink other than water is going to be acidic. Even things like coffee and tea are acidic. So if you're a diet soda drinker and think that you're safe because there's no sugar in it, well, I hate to break it to you, but those drinks are very acidic and they will slowly damage your enamel and cause this erosion. Another cause is teeth grinding or bruxism, where you literally just start grinding your teeth back and forth or clench your teeth all night long. And a lot of times people don't even realize that they're doing this. But when you grind your teeth, it can lead to a lot of damage to your teeth. It can cause your teeth to be cracked. It can also start destroying the enamel on the top of your teeth. And it can also cause something called abfraction lesions, which are basically these punched out lesions right by your gum line. And these usually happen because of the flex that you put on your teeth when you grind and put all that stress on your teeth. Over time, it can lead to these microfractures right by the gum line that cause those punched out looking lesions. Also, just the pressure that you're putting on your teeth, if you're grinding your teeth all night or clenching your teeth, is going to make your teeth more sensitive anyway, because you're going to be creating a lot more inflammation. And speaking of inflammation, if there's any inflammation throughout your mouth in general, your teeth are going to be more sensitive. So if it's been a while since you've had a cleaning, or you don't really brush your teeth properly and you have a lot of plaque buildup and your gums are super inflamed, then your teeth are also more likely to be sensitive. And surprisingly, a not so common cause of teeth sensitivity is a cavity. Usually when cavities are smaller, even though they're a full-fledged cavity or a hole inside of your tooth, they usually don't hurt. It's not until they get really big when cavities start to hurt. Now, this isn't always the case. Sometimes even small cavities can be painful for some people, but for most people, it's not until it gets a lot bigger. Now, what's the best way to fix tooth sensitivity? The first is going to be switching to a sensitivity toothpaste. If you haven't already tried this, I guarantee you it's going to make a difference. So a toothpaste that is specifically for sensitivity, like Sensodyne or any other toothpaste that says for sensitivity on it, is going to have minerals in it that will block these dentinal tubules that are exposed. So for example, one common ingredient is potassium nitrate, and these are literally designed to block any exposed nerve endings in your teeth. Now, sometimes you have to use this consistently for a couple weeks, and it's recommended that you do not rinse with water after using this toothpaste. Instead, you can still spit like normal, but you want to leave a film of that toothpaste on your teeth so you can keep that mineral in there that's blocking those tubules on your teeth longer. If you're the type of person that absolutely has to rinse their mouth with water after, at least try leaving a film of that toothpaste at nighttime so you can keep that on your teeth. But that way, during the daytime, if you want to rinse with water, that's fine. But at nighttime, at least try to leave that film on your teeth then. The other thing you can do is a fluoride treatment. So usually after every cleaning, your dentist or your hygienist will ask if you want a fluoride varnish, which is literally just a little paintbrush with some fluoride in it that will go over your teeth and help remineralize them. Fluoride is a mineral that will remineralize your teeth and actually strengthen your teeth. But it's also really good in cases where you have thinner enamel or where your roots are exposed and you have sensitive teeth. And it's very simple and it takes like 5 seconds. Your dentist just has to paint it over your teeth and it'll feel a little weird and grainy and you'll have this weird texture to your teeth, but it will stay there. Your saliva will help it stay on your teeth, and this will keep remineralizing your teeth. I've had a lot of success by just doing this and getting rid of people's sensitivity. Now, the thing is, this isn't a long-term fix. A lot of times people have to get this like every 6 months or so because over time the sensitivity will come back. I'd also recommend looking into a night guard. So if you're one of those people that grinds their teeth or clenches their teeth, or you don't even know if you grind or clench your teeth, then you can also ask your dentist to see if you do. But a night guard is basically a piece of plastic that goes either on your top or your bottom teeth. And when you're wearing this, instead of grinding your teeth away, you'd actually be deflecting all those forces over this plastic. And this will protect your teeth and also not create that inflammation from all that stress you're putting on your teeth. So not only is this going to prevent your teeth from getting damaged, if this is the reason that your teeth are sensitive, then it can eliminate that. Now, if your teeth are sensitive because of a cavity or a fracture to your tooth, then really the only thing you can do is get your dental work done. But this is also why it's so important to keep going to your dentist every 6 months to see if there's any issues going on and you can address them early if needed. Now, just some general other tips to prevent your teeth from getting sensitive. The first is just normal brushing and flossing, but having proper technique. Like I said, when you're brushing, you want to brush gently. With your toothbrush, you can angle it at a 45-degree angle towards your gum line and be really gentle with these circular motions throughout your mouth. You can also use an electric toothbrush that works even better. But in general, when you keep your teeth clean and you limit the inflammation or the plaque in your mouth, that's just going to make your teeth healthier and less sensitive overall. We talked a little bit about your diet, but you want to really avoid acidic foods. And again, pretty much anything other than water is going to be acidic. So if you have to have your coffee or if you have to have your red wine with your dinner or something like that, at least swish your mouth with water afterwards to kind of dilute the pH in your mouth. You can also try chewing gum after your meals or after you have something acidic, which will produce more saliva that will naturally dilute the pH in your mouth. The only thing is you want to make sure it is sugar-free. I'd actually recommend getting chewing gum with xylitol in it, because xylitol is actually a product that can prevent getting new cavities. So not only will you be getting more saliva, you'll also be getting this antibacterial component as well. Now, the last thing I want to talk about when it comes to tooth sensitivity is teeth whitening. If you're the type of person that loves whitening your teeth, you got to understand that teeth whitening can cause your teeth to become sensitive. So if you already have really sensitive teeth and you're thinking about getting your teeth whitened, then you got to keep that in mind. You might want to have some sensitivity toothpaste ready or take it slow at first, knowing that you already have sensitivity issues. So just to kind of recap, there's a lot of different things that can be causing tooth sensitivity. This is why it's really important to go to your dentist to figure out what could be going on in your mouth. Now, I hope you liked this video, and if you haven't already, make sure you hit the thumbs up button and subscribe to my channel below, and I will see you guys in the next video. Have you ever felt unhappy with your teeth? I mean, they can be perfectly healthy, but they could still be damaged, whether they have some chipping or some cracking in them. If this sounds like you could be making some common mistakes that are damaging your teeth, even though you're keeping them clean and healthy. So in this video, I'm gonna go over 7 reasons